Okay, so hello everybody. My name is Maddy Doucette, and today I have the pleasure of speaking with Dr. Jonathan Hakun. Dr. Hakun is the Director of Cognitive and Mobile Phenotyping Neurolaboratory at Penn State University College of Medicine. His research is focused on the cognitive neuroscience of aging, particularly cognitive and brain health over the adult lifespan. So Dr. Hakun is going to be speaking at the upcoming SNS Symposium in Philadelphia in May, and his talk is titled Ambulatory Assessment in Concussion Clinical Care. Dr. Hakun, it's a pleasure to have you here today. Thank you for
Thanks, it's a
joining
pleasure being
me.
here. Yeah.
Yeah, and for offering us a sneak peek into what sounds like a very interesting talk. So I have some questions here for you. First off, why don't we just start with briefly, what is ambulatory assessment?
I think at the broadest level, ambulatory assessment simply refers to the collection of information or data from individuals over the course of their daily lives. Ambulatory referring to being moving around. And in recent years, I think the dissemination of tools, pervasive technology like smartphones and wearables has really taken that approach to a different level. We've seen an increase in the frequency or the continuous nature of which we can collect this sort of data. So with smartphones, we've seen a lot of the development of ecological momentary assessment protocols where we ask people anywhere from once a day or multiple times a day to respond to prompts or notifications that come in through a smartphone application or even just through text message. And then also in that vein, we've also seen the development of wearables that can collect data continuously, physical activity monitors, fitness watches, and so forth. The other innovations we've seen in this space that really have taken ambulatory assessment into new directions are other smart devices. We've seen the rise of devices that can capture information about environmental air quality and also do really nice algorithmic analysis of sleep and sleep quality. Most recently in our lab and our team, we've developed tools for ambulatory cognitive assessment. So I'm putting another word in the ambulatory assessment protocol. But the idea is that we can deliver really brief assessments of multiple domains of cognition in anywhere from 45 seconds to a minute per administration, which is really takes stuff that we used to do in the lab and in the brick and mortar or the clinic and brings it out to people's everyday lives. So in a nutshell, that's kind of the space. There's a lot more going on there, but these are the tools we think about in our research.
That's great. Yeah, it seems like super innovative field to be in right now with all the technology advances that are coming out. So that's really great.
Yeah, it's a
Um,
ton of fun. We actually have to play a lot of wear a lot of different hats in terms of getting familiar with the technology and also its integration, as well as all of the back end tools that we need to continue doing research like that, including the different varieties of statistics that back fast time scale data collection. So
yeah,
it is a lot of fun.
yeah, that's awesome. Do you think you could speak briefly about how ambulatory assessment might, I know you did a little bit, but how it differs from traditional assessment, but maybe particularly within sports neuropsychology or concussion care?
Yeah, I think you've seen an evolution, specifically in the sports space, where conventionally, I think if we were concerned about potentially neurocognitive deficits associated with concussion, for example, um, they were conventionally done paper and pencil. It would be done with proctored, right in front of a
Hmm.
neuropsychologist, somebody licensed to do that work, or a psychometrician. And then over time, we saw the rise of digital testing. So you have packages that it can be brought out to the playing field, for example, on a tablet or a laptop, administered right then and there by either a coach, athletic trainer, or the rest. And this next space of ambulatory assessment pushes the envelope just a little bit farther. First was the goal of adapting those assessments to be valid, brief enough, and accessible on a smartphone form factor, something smaller that you're using maybe your thumbs or your index finger to respond to. And then the second part is coming up with a protocol that matches the time scale that you're interested in. You think about concussion, for example, you've got an injury that will change rapidly from the first day through, let's say, return to play 30 days later,
Hmm.
28 days later, 14 days later, whatever the case may be. And the course of that recovery can be captured when you get in there with the ambulatory protocol and don't overburden the patient. If you allow people to give you a picture of what their cognition looks like within and between days in a very light touch manner like this, you have the ability to see a time course of change and draw new insights from that sort of that data stream. So the major difference is that we're there with an individual when they're experiencing the symptoms. If you think about everyday life and the life of somebody going through the injury, there are moments where it's quiet, they're resting, maybe they are on their phone as it is, but that context may or may not be provoking symptoms and may or may not provoke an experience of a cognitive impairment. But in the middle of school or following some physical activity, if there is a change in the status of the injury or change in the symptoms, we can capture how that relates to cognitive functioning in those moments because we're there with the assessments with them. So it's not the snapshot that you get with the single time testing, it's painting this kind of like multi-frame video of what their cognitive change looks like. So that's a major difference in that regard. But beyond the cognitive assessments, we also have the ability to surveil what environments people go into and how their symptoms react to those environments. The cognitive piece is just one bit. When it comes to the bulk, the lion's share of concussion testing, you're talking about trying to get a sense and a picture of how burdensome the symptoms are, which variety of symptoms people are experiencing, and also try to get a sense for a lot of modern work in this area is focused on, does this symptom react to these types of environments? Do you wake up time-based with a headache? Are you experiencing cognitive fogginess or slowness or headache at the end of the day after cognitively exerting? We've been able to take these tools and adapt them to the time distributed sampling methods so that we can paint that picture and see within day change or day-to-day change and variation. So I think the major difference methodologically and even insight is that we're not asking somebody to say, hey, go back to last Thursday when you were in school. Do you recall how you felt? We could look up last Thursday and see how they performed after they left school or what they felt like.
Yeah, that is so fascinating, and I think it has so many implications for concussion care. And it was making me think too that it's so much more accessible for athletes who might be in more rural environments or might not have access to some of these assessments that they can go in day of, and so you can reach so many more athletes as well, which is really awesome.
I think that's a real advantage. We've talked a lot in our team about closing the gap on health disparities that may be geographic or they may be economic. The geographic piece is really important because you can imagine the specialized care that exists mostly in larger towns, larger cities, East and
Hmm.
West Coast often, and then being able to multi-stage screen to see if somebody needs access to specialty care quicker or could gain telehealth access by way of getting a picture of where they are with these ambulatory assessments, delivering them right out to them, and then having either supervised by an individual or algorithmically determined whether somebody would need further follow-ups. An area we haven't played with yet, but we've considered that option of, maybe a two-stage screening approach would be great.
Yeah, I agree. That'd be amazing. Awesome. Well, thank you so much for all of your insights. And I guess I just have one kind of final question of what you hope neuropsychologists or people attending the symposium can get out of your upcoming talk.
Yeah, I hope we could paint a picture that, and this is the picture we try to paint with all of our focused analyses on the data collection projects we've done so far. I want to paint the picture that, using these tools can provide insights that we can't get from conventional approaches. It's not here to replace, it's not here to alter even the behavior in clinical care from the outset. What the idea is, can you capture specific presentations that you mostly rely on self-report to see? Is there a chance that we can identify people that are experiencing a specific symptom or impairment? Can we detect that when they're experiencing it, even if they don't do a good job of recalling and reporting on it? Which is I know the biggest part of the art here is pulling this out of a patient when you're working in the clinical interview. So we want to be able to do things like that. What we hope to share with everybody is that some of the higher frequency assessment approaches are very feasible and tolerable by patients. This is something we've been studying, just how much burden do they create? We're seeing some really good outcomes with respect to people actually viewing this as something that has helped them recover, and they feel like they're doing something active about their path, which is nice. And then finally, just about those insights, can we identify new ways to treat or to care for individuals based on what we see happening for them specifically in their everyday context? Colleagues that we work with say, use the environment, use these exposures as a therapeutic mechanism. Can we use an episode of physical activity that they do react to as part of the plan for how to get them back to, um, you know, back to the field to play? And methods like this allow us to not only surveil and monitor for when they're engaging in those episodes and activities to see that they're adhering to the advice they're given when they go home, but also we can see whether they're good responders. We can adjust the dose. We can do more of a precision medicine approach because we're there in their pocket with these, computers we carry around with us all day long. So I hope that the take home is what people are seeing is, yeah, that has a chance of helping improve care overall.
Yeah, that's amazing. Yeah, it sounds like it definitely can. And there's a future for ecological momentary assessment and ambulatory assessment in concussion care. So thank you so much. Thank you again for talking with me today. And we're looking forward to your talk at the SNS Symposium in Philadelphia this May. So for those of you watching, you can find more information and register for the symposium at the SNS website, which is sportsneuropsychologysociety.com. And you can follow SNS on Twitter and Facebook for updates. So thanks again, Dr. Hakun.
Yeah, thanks so much, man.